So an average risk individual is someone who's 50 years old, and that is the age when we do recommend screening. And then having a screening procedure done has to be done so that you weigh the risks versus the benefits, because there's risks to doing a colonoscopy and then there's benefits to having it done. So about 20% of patients who are 50 years old will have a polyp. So it's felt that the benefits and the chance of finding a polyp would far outweigh the risks of doing the procedure when one is 50 years old, provided they are an average risk individual. There are certain patients, though, who are at an increased risk of developing colon cancer, and they need to have screening done at an earlier age. So if someone has a first-degree relative, for instance, of either colon cancer or polyps, so a first-degree relative would be a parent or a sibling, they would need to have their colonoscopy done either at the age of 40 or 10 years younger than when their first-degree relative had found their colon cancer or polyps. Other conditions, such as ulcerative colitis or Crohn's disease involving their colon, may also change when someone requires colon cancer screening. So when one starts screening for colon cancer and inflammatory bowel disease is very much dependent on the type of inflammatory bowel disease they have and how serious it's been in their past. Screening, by definition, is in patients who have no symptoms. So if you develop symptoms, which could potentially be worrisome and represent either a polyp or colon cancer, you would then look and do a diagnostic test, such as a colonoscopy, and that would not be for screening, but that would be to look for the cause of those symptoms. And that could obviously be done at any age, depending on what those symptoms are and how concerned one would be about them.